Serious, what were some small or strange health symptoms you experienced that turned out to be something more serious? I've never had a period. I had one regular period my sophomore year of high school, and then nothing, just some spotting, or maybe the occasional cramp for 3 more years. I just assumed that my body was trying to regulate itself, or whatever, until my doctor saw that I wrote May 2016 as my last period. I had to get a bunch of blood work done, and as of right now she is going to monitor me for the rest of the year. She mentioned that there is a chance I could have something called PCOS, which after some research on my own, turns out it can lead to infertility. I thought it was strange I didn't have a regular schedule, but I never thought to ask about it. I'm kinda stuck in limbo now, waiting to see what is wrong with my body. I'm almost like you. I have super irregular periods, which I later found out was due to my health and hormone issues. My period didn't come for a whole year during my exchange year abroad, because I kept getting sick. My host family put me in their sleep out, and being exposed to the cold every time I went in and out of the main house was the reason why I kept getting sick. When I'm stressed, or don't eat, or sleep properly, it also stops coming. This year I've only had 3 months worth of periods. I thought this June would the 3rd month straight of not having it, but I had recently started taking 200 milligrams of vitamin E every day, and started getting up early, and sleeping early again, and it came back. I was in New York with my family when the night before our last day I felt like I couldn't actually get a full breath of air in. My family and I mostly brushed it off, because our lungs frankly aren't really used to city air. The next morning I woke up with a 105 fever, and I felt like I had no energy. My dad still wanted to make the best of our last day, so I mustered up the ability to walk around Chinatown with them for the whole day, while mostly leaning on one of my 2 parents. We immediately flew home after we had lunch, and straight to the doctor's office, got an x-ray and a concerned look from the doctor, because what he saw was a high schooler's ray with lungs covered with splotches in my lungs. I went for an MRI scan and got a lot of tests. Turns out I had a case of double pneumonia that was so bad it literally looked like I had lung cancer. Dude, 105 degrees and he wanted to make the best of your last day? I'm pretty sure 105 is considered a medical emergency. Yeah, that whole morning I was really just sitting in the bathtub splashing water on my head, but I definitely wasn't a fan of walking around after that. Isn't that right on the cusp of irreversible brain damage? A little over 4 months ago I started feeling very strange at work. Like, you know those old TV shows where they'd go into a dream sequence and everything was fuzzy and out of focus? That. I was walking and talking, but not 100% present. It had me freaked out, so I went to a co-worker's office, sat down, and tried to explain what I was feeling. After a bit, he asked, "So, do you want to go to urgent care?" He'd been through a heart attack, so I said yes. Arrived at urgent care a short time later. They took my blood pressure and said that there were 2 emergency rooms nearby, and which one did I want to go to? Not if, but which one. The diagnosis was malignant hypertension. I wound up in the ICU for a couple days and have been on a shit ton of BP medication since. The episode happened about 4 in the afternoon. If it had happened at 4 in the morning, with nobody around to take me to the hospital, I might be a lot more dead right now. Wow, so glad you're okay. Also, that last sentence made me laugh. That sounds like a symptom. Reading about it, did they find the underlying cause? Thought I had a bug bite on my forearm. Over the course of 2 weeks it became painful to hold anything. Then it became painful to move my fingers. Forearm swelled to roughly 1.5 times its normal size. About a week later, 3 weeks from when I first noticed the bug bite, girlfriend just takes me to the ER. They say, "Oh, it's probably a bug bite, but do an ultrasound anyways." Doc starts telling the nurse he needs a list of things, and when she comes back she has 2 other nurses with her. Turns out I had an abscess. They cut it open and cleaned all the dead tissue and pus. Was about 1 long x1, 2 wide x1, 2 deep. Infection had started killing the muscle, but luckily hadn't got tendons yet. Still seeing a wound specialist over it. The extra nurses were there to watch, cause I guess they like that kinda stuff. I'm just glad it didn't turn out to be spider laid eggs in me. Having personally gotten a staph infection and seen one get so bad on a friend's leg in high school, I'm very paranoid over things that look like normal things. That is a bug bite or acne. I suffer from migraines. True migraines, not headaches that lots of people just call migraines because they think they are the same thing. Generally my migraine aura involves seeing flashes of light and speech changes, lost feeling in my right hand, have vertigo and stumble a lot when I walk. I honestly thought this was just evolution of migraine symptoms and had an appointment with the neurologist coming up when they started anyway. Mention this to my neurologist and get an MRI. Come to find out I have 5 lesions in my brain and more on my spine. Now I'm being worked up for manuscript. Ironically, I'm an RN on a neuro unit. Same thing happens with me. My migraine suddenly got so much worse, so I was referred to a neurologist. He wouldn't give me an MRI though, because he had one on file from 3 years ago that looked normal. I asked about manuscript because my aunt has it, and he dismissed me saying that manuscript patients usually don't have migraines, and said he rules manuscript out anyway because the probability of having manuscript is much lower than migraine. Horrific diarrhea 24/7 plus I couldn't hold it long once I had the feeling to go. I had about 1.5 to 2 minutes to get myself situated because it was coming no matter what I did. I drove around with large plastic Starbucks cups and would fill the whole thing every time or just pull over and go. I suffered with this for like 3 years because I didn't think it was anything because it would happen like 2-3 times a month, but once it started happening more and more, like more than once in a week, and then got even worse like daily. I finally went to the doctor. I had to get a colonoscopy at 20 years old. I guess I have celiac disease paired with a spasming intestines. I've been gluten-free for about a year, lost 30 pounds and don't have any issues unless I get a cold. You drive around for 3 years squirting liquid poo into a plastic cup, and you didn't think to go to the doctor? How much is medical care there? This happened many years ago when I was a teenager. I woke up one day with no energy. I was always thirsty, but I just thought it was because I live in Arizona and it was getting hot. I was always hungry, but I was losing weight pretty quickly, and I had a few people ask me what I had eaten because I smelled like fruit. It was all weird, but I didn't really care at the time. My grandpa sat me down one day and tested my blood sugar. He was a diabetic and his meter just said high. My blood sugar was so high testing machines couldn't read it. My mom took me to the hospital right away, and I was diagnosed with type 1 diabetes. I was also in ketoacidosis. I let it go for so long that I probably would have died in the next 24 hours had I not gone to the hospital. My blood sugar was around 800 when I went in. I spent 2 weeks in the ICU getting fluids and an insulin drip. In high school I went for a standard annual checkup and did poorly on my vision test. My pediatrician referred me to an ophthalmologist, and I was excited because I really wanted to wear glasses like my best friend. The ophthalmologist found that I had a small blind spot in my field of vision. It was so tiny that I never really noticed it. Also worth noting, I was having increasing headaches around the same time, but I didn't think much of it because I got headaches a lot growing up and always wrote it off as being tired, hungry, etc. They sent me for an MRI and that's how we found out I had a brain tumor. It explained so much in retrospect. My moods were really affected. I was so angry all the time and very depressed. But this could so easily be written off as teenage hormones. It's crazy to think that it could have gone unnoticed much longer if it hadn't been for that one eye exam. Major depression and anxiety. Always needing to sleep. My emotions were pretty extreme. Turns out I was extremely anemic, 200 milligrams of iron every day for 2 months. I didn't realize anemia can look like depression. I felt like a new person once I got treated. I'm anemic and have been feeling my symptoms coming back regardless of the iron I take. Wonder if it's time to up the dosage with my document. Ask them to take a look at your ferritin levels. That's the binding portion needed to bind iron. Yeah, I was just tested in January and was at 60 up from 20, so now I'm in the low side of normal I think. Maybe investigate why you are not absorbing iron, or where you are losing it from. Rheumatologist sent me to Ginny. If that doesn't explain it, I need to see gastroenterologist for colonoscopy gastroscopy. I have always, as far as I can remember, bruised easily. My friends thought it was funny, so on nights out, they'd pinch me hard, and I would wake up the next day looking like I had been in some serious ST. I always brushed it off, because I had no other symptoms of anything. My blood clots normally, and I'm not especially prone to nosebleeds or anything. As a result, I never bothered getting it checked out. Ended up in hospital last year for something unrelated, and had a platelet count done. Turns out I have presumed chronic ITP, immune thrombocytopenic purpura, and a platelet count that is 10-15% of what is considered normal. It doesn't really impact me in my day-to-day life. I'll need a platelet transfusion before surgeries, and I can't do stuff like bungee jump, because it could cause bleeding in my brain. But other than that, it's all good. Not exactly sure if this counts, but I have enough trouble sleeping to where I can barely sleep at all without the help of sleeping pills. The pills I had been taking had slowly been losing their effect on me, and since I needed it to sleep and was an idiot, I just upped the amount I would take, and as I kept going up, I noticed the feeling I had whenever I took them started to change. I went from feeling nice and drowsy, easily falling asleep in minutes, to being incredibly tired and itchy all over. One night I was staring off into space and thought I saw something moving, but paid no mind to it because I thought it was normal. After a few months I got fed up and decided to talk to my doctor. Turned out everything I had described were signs of overdose, and I had been overdosing nearly every night for months and didn't even know it. When I was in the military, I started having a strange ache in my abdomen. Ignored it for about 2 days. The third day I had everything coming out of both ends mostly non-stop. Made it to sick call that day, and they told me I had the flu. Later that night, while on patrol, my partner found me unconscious behind the wheel and took me to the ER on base. Turns out my appendix had ruptured on that first day and I didn't know about it. Emergency surgery 2 hours after arriving at the ER, and 2 days in ICU and 5 more in a regular bed after they told me that I was born with 1 kidney and I was being discharged because of it. Fun times. Were you up at JBLM Washington? Fort lost in the woods. Misery. Jim, what kind of poison did you use?